So I'm Matt Winton. I'm our Chief Operating Officer here at Inozyme Pharma. Inozyme is a biopharmaceutical company focused on developing therapeutics for rare diseases that affect both bone health and blood vessel function. So we're developing a novel enzyme replacement therapy, INZ-701, for the treatment of ENPP1 and ABC6 deficiency, both genetic diseases, as well as calciphylaxis, which is a complication of end-stage kidney disease. Now, our lead program for ENPP1 deficiency is in phase 3 trials, and we're expecting top-line data early in 2026. So ENPP1 deficiency is a rare condition. The genetic prevalence is about 1 in 64,000 births. It is a disease of infancy, of pediatrics, and of adulthood. And it's linked to the disruption of the PPI, or inorganic pyrophosphate, and the adenosine pathway. So ENPP1 is a membrane-bound enzyme that converts extracellular ANP to generate PPI, to generate the inorganic phosphate, and adenosine. Now, both PPI and adenosine play important roles in maintaining bone health and blood vessel function. So we've known for a while now that PPI is a key regulator of bone and soft tissue mineralization that acts by inhibiting the formation and the propagation of hydroxyapatite crystals. Now, adenosine is critical for regulating vascular smooth muscle cell proliferation and preventing stenosis. So mutations in the ENPP1 gene lead to a loss of function in this important enzyme, and consequently, you get low levels of PPI and adenosine, which results in atopic calcification, skeletal undermineralization, intramural proliferation, and stenosis, which leads to a very progressive and highly morbid condition that, as mentioned, affects infants, adults, and pediatric population. So I think like all rare disease diagnosis is a challenge, and we've done a lot of work as a company to increase awareness, increase medical education, and access to diagnostic tools, including genetic testing. And especially our disease, the ENPP1, like many rare diseases, has a very heterogeneous presentation in different patient groups. So clinically, ENPP1 can show up in infants as generalized arterial calcification of infancy. And this can be diagnosed as early as prenatally by the second trimester, or postnatally. Patients have calcification of their large blood vessels. They get calcification of their heart, which can show up on sonograms or CTs. They have respiratory distress and severe cardiac impairment, which unfortunately leads to a mortality rate of about 50% within 6 months, mainly due to cardiac complications. Now, the patients that survive GACI, survive the infancy period, the disease phenotype kind of shifts and becomes more of a bone phenotype. We see about 100% of these patients in their pediatric years develop rickets. They have bone deformities, knock knees, bone fractures, and they continue to carry with them the calcifications that they have had throughout their cardiovascular system as infancy. And that progresses through adolescence and adulthood, presenting with osteomalacia, soft bones, bone fractures, bone pain, calcification of the soft tissues in the joints. And many of these patients also get calcification of the bones in the ear. And unfortunately, that leads to hearing impairment as well. We're really excited about this new publication. We collaborated with leading disease experts from across the world, and this is the longest retrospective analysis of ENPP1 deficiency. So I think like a lot of rare diseases, previously our understanding of the clinical spectrum of ENPP1 deficiency stemmed from small studies or case reports, where there can be a lot of variability in the clinical presentation. There's always limitations to the follow-up, to the type of data that you can collect. But for the study, we used data from previously published large retrospective natural history studies, and we performed a subgroup analysis to illustrate the onset, the medical burden patients have over their lifetime, and the impact that these patients live with. There were 84 individuals with ENPP1 deficiency in the study, both patients that have presented with GACI, with HR HRAR2 or rickets, or patients who started with GACI and have progressed to HRAR2 phenotype. We saw over about a 40% mortality rate in those that were diagnosed with GACI, and 64% of those diagnosed with rickets also had cardiovascular manifestations of the disease. So it's a pretty representative sample of the patients that we're seeing in the clinic. The study really characterizes the severity and progression of ENPP1 deficiency. It illustrates the severe cardiac implications that start as early as infancy to the significant muscular skeletal complications over a lifetime, from childhood to adolescence, to adulthood. For us, I think we believe that our lead investigation therapy, INC701, is uniquely positioned as a potential therapy that addresses the underlying cause of the disease and should have impact at all of these critical patient segments that we see presenting in this disease. Couple highlights, by the age of 10, approximately 70% of patients develop serial muscular skeletal complications, primarily rickets, and these significantly impact their quality of life. Many of these patients also demonstrate additional complications like hearing loss, joint involvement, pain, ongoing risk, cardiovascular problems, so really serious disease impact. As this disease progresses, and what this study really shows is the lifelong impact that this disease has, looking past infancy and childhood as well. By the age of 20, 90% of patients go on to develop musculoskeletal complications. And we were able to go out to the age of 55, where over 95% of these patients had severe cardiovascular, musculoskeletal, and other organ complications associated with this disease. So this is truly a lifelong rare disease with extremely high unmet need and patient burden that, here at Inozyme, we're really excited to try to bring new innovative therapies to this community. And I just like to call it, studies like these, can't be possible without the commitment and collaboration of the GACI community, as well as our collaborators in the medical field across the globe. And so we are grateful for the continued support and continued partnership to be able to further our understanding of this important rare disease. And this types of information, furthers our understanding and hopefully allows us to bring, new novel treatments to the community quicker.